Hey everybody, I'm Sandy Middleton, the Executive Director for the Center for Violence Prevention, and we're here today at Merit Health, and we are marking the end of Sexual Assault Awareness Month. And we're joined by one of our rock stars, nurse practitioner Beth McCord. Beth, tell us about what you do.
So I'm Beth McCord. I am the Operations Manager for the Bridge Forensic Services. We started that in 2018 to provide an alternative or another option to patients who had been a victim of sexual assault or rape if they did not need the ER or a hospital setting to have their exam completed. And in 2019, we branched out and started getting partnerships with hospitals that we could provide a SANE, which is a sexual assault nurse examiner, someone who had been trained in how to collect the evidence collection kit, and we partner with the hospital so that we could provide that service to the patients that came into the hospital and maybe were not medically stable to come to our clinic facility.
We're also joined today by Christine Shirley. Christine, tell us a little bit about who you are and what you do.
Hi, I'm Christine Shirley, Emergency Department Director for Merit Health.
So Christine, how does it look here at Merit in the emergency room when a person presents with a sexual assault or a rape?
Okay, well, we start off by the person still comes through our triage process. Once they hit triage and we recognize that that patient is a sexual assault or a victim of sexual assault, then we immediately contact Beth or someone on her team to come and assess the patient.
Okay, and what's the advantage of that? What advantage does that provide to the patient that you're able to call Beth?
Well, typically the best care provided for those patients is someone that is SANE certified. It is very difficult over the last couple of years to get a SANE certified nurse in the ER setting. So just that expertise in that area actually allows our patients at Merit Health to get the best possible care provided.
And that's part of the reason why we did the MOU, was because of the difficulty that some of the metro hospitals and really hospitals all over the state were having with keeping SANEs on staff in the emergency rooms, because we all know that nurses sometimes will move from hospital to hospital, and so it was difficult to be able to keep the training component and keep those SANE certified nurses here in the ER, right?
That's exactly right, yes.
Okay, so Beth, what does it look like when you get a call from one of the metro ERs that they have a victim?
So when we get a call, it comes to our call center at the Center for Violence Prevention, and that is a staff person who's on call. They will then call the SANE who's on call, and we immediately go to the facility. So the SANE, along with an advocate, will report to be able to meet the needs of that patient. All of our nurses are SANE trained, and that means that they have been to at least 40 hours of didactic training with a lab component on that. And then we also have two, myself being certified in adult and adolescent, and then we have another nurse who is certified in adult, adolescent, and in pediatrics, and they will be completing the exams. Just to talk a little bit about the difference in that, you don't have to be certified. The certification is the highest level that you can get. When you talk about the being SANE trained or SANE educated, SANE education is you're a nurse, you're an RN, you've had some education regarding the forensic kit or how to take care of a patient who's been a victim of that. And then the 40-hour training, has the whole every component along with how to collect the exam, and then that highest is the certification. So we do have certified SANEs who are on our staff that will be coming out to complete the exam, but that's not something that you have to be a SANE.
And to piggyback off of what Beth said about the SANE, or the Sexual Assault Nurse Examiner, for the first time we were able to define a SANE in state law last year in House Bill 1559. And so we're really excited about that, because we're hoping that'll take some of the confusion out of what is a SANE, and that actually, like Beth said, when a nurse completes her 40 hours of training, she is a SANE. So that's a really important piece. And now I want to go back to just how much we want to celebrate this partnership with Merit. It's an emerging opportunity that we have here. This is, as far as I know, the only one in the state that, that's able to respond to local hospitals and provide the specialized service. So we're really excited and thankful that Merit has been so open to this new offering for victims, and it really has helped so much. So one of the things that, Christine, we talked about is how much you appreciate having that specialized care. Can you talk to us just a minute about what that looks like?
Sure. So when a victim comes into the emergency department, especially for sexual assault or a rape, they are traumatized in such a way that if you've never experienced it, it's very hard to deal with. And whenever we partnered with Beth, and she told me that they actually had an advocate that would come to our facility and support them emotionally, as well as do the exam and provide all the medical expertise as well. That emotional support for that victim and that family is really something that we would love to offer and could offer as a nurse, but sometimes the words just don't come to you and you're just not sure, what do I say in this circumstance? What's out there in the community that can help them after, because it doesn't stop when they leave the emergency department, right? Like, this victim has to go home and deal with this for really the rest of their life. And so what Beth and her team has offered for this emotional support as well is amazing. And that is something that I think lends to just an amazing outcome for these patients. And Beth can tell you a little bit about the service that they offer even once the person leaves the hospital.
So all these services that we offer, all these specialized services here in an emergency room, what does that cost, Beth? What does it cost a victim?
Well, Sandy, that's a good question. A lot of times we have run across patients that don't want the exam done because maybe they can't afford it, they don't have insurance, or they're wondering how much it's going to cost them. And when a patient presents to the ER with that complaint and they do the exam, that there is no charge to them. There is a special fund through the Attorney General's office called Victims Compensation, and Victims Compensation will pay for that exam without them even having to do a police report. So there's no charge to the patient for the exam. And with our services through the bridge, through the Center for Violence Prevention, there's no charge for any of our services. There's no charge for the SANE. There's no charge for the advocate. The hospital doesn't even receive a charge. So once they leave here, we are able to offer them shelter services if it's deemed necessary that they are unsafe to go back to where they were. We can also provide them outreach services, which would entail case management, helping them work their case, helping them follow up with law enforcement or with medical doctors if they need follow-up appointments and things like that. Also, the most important piece, or what I consider the most important piece, is therapy. And we have therapy services that are totally free. All of our services are also confidential. So once they do come on, the nurse may call and say, hey, I just want to check on that patient. And we're going to have to tell them that we don't know who they're talking about. Because once we leave that situation, we protect that patient and their confidentiality is totally protected. Our advocates are volunteers, so if you're interested, you see this video and you're interested in learning more about that service, you can definitely find us on our website and reach out to become a volunteer advocate.
If a victim comes to the ER or to the bridge and has suffered a sexual assault or a rape, do they have to cooperate with law enforcement?
So the state law is very clear in what has to be reported and what doesn't have to. So for a person who is an adult, 18 years or older, most sexual assaults they don't have to report. Following state law, if a child was involved or a hunting or boating accident, gun or knife was involved, things like that have to be reported. The sexual assault itself doesn't have to be reported. And then when you talk about people who are under 18, there are some reporting requirements, but for the most part, the patient can come and receive medical services, including a forensic kit collected, without necessarily having to call the police.
And they also have the opportunity to come to the bridge itself. We didn't talk much about that, but you know, we certainly love our partnership at Merit, but a victim can actually choose to come to the bridge, or law enforcement may bring them to the bridge, which is located in Pearl as well.
That's correct.
So if you're a victim of sexual assault or rape, or you have a friend who is, you can always call us directly at the Center for Violence Prevention. The number's listed here on the screen. We'd also love to encourage you to like and follow us on all our social media, our Facebook, and our website's available as well. It's where you can find a lot of information. There's videos and things that you can learn about all the different issues that are covered at the Center for Violence Prevention. So thank you again to Merit Health. Thank you for joining us in this wonderful offering for victims, for this trauma-informed approach, client-centered, and you know, we're so excited to be able to offer this to the people in the Metro. Thank you for joining us.